People suffering from COVID-19 are concerned about a new disease, black fungus. Various states across India have started declaring a black fungus epidemic because the cases of this rare infection are increasing in COVID-recovered patients. The fungal disease mucormycosis has 50% mortality rate, which means of every 2 patients, 1 dies due to this disease. So it has now become important to talk about this disease, and in the end, I will give you a tip which you can apply immediately to save yourself from this infection. So stay tuned. What exactly is the black fungus? Black fungus infection or the lethal mucormycosis is caused by a group of molds called Mucormycosis, which is present in air and cause complications when inhaled into the lungs, spreading into the sinuses and chest cavities. It's just like you putting bread outside the refrigerator for 1 or 2 days and getting some unwanted fungal growth, and now the bread becomes poisonous to eat. So just imagine, if this fungal growth comes in contact with your alveoli of lungs, what damage it can do. At present, it is only seen in COVID-recovered patients. But why? Dr. Mahajan, who is ENT consultant at Fortis Hospital, explains that the reason for mucormycosis spreading rapidly is the indiscriminate use of steroids. Steroids used in high doses or over a long period of time can lead to mucormycosis, because steroids can also reduce immunity and have tendency to increase your blood sugar levels, even in non-diabetic patients. It creates an ideal environment that allows the spread of infection. In first wave, cases were there, but they were very less. But now in second wave, the cases are more and the severity is also a concern. Talking about the symptoms of this disease, the most common symptom is facial deformity like dropping eyebrows or eyelids, restricted eye movements, stuffy nose or bleeding from nose, headache or pain in cheeks. Since the fungal molds can be inhaled by patient, this infection can spread across your respiratory tract, causing severe lung infection. Pulmonary complications can also start off as chest pain, headache, fever, cough, which are also the symptoms of COVID-19 and can also be seen in mucormycosis. Diagnosis. Preliminary diagnosis involves patient's history, physical examination, and risk factors involved. Scans like CT scan or contrast-enhanced MRI scans can be done to see the extent of infection. But there are no serological tests helpful in this disease. Treatment for mucormycosis has to be very fast and aggressive. This need for speed is because by the time even a presumptive diagnosis is made, often the patient has suffered significant tissue damage which cannot be reversed. Antifungal injection, amphotericin B, is also given to patients of mucormycosis. That's why it is in short supply right now, just like remdesivir. A stepwise approach has been developed to treat this disease, and according to severity, various treatments and remedies are also available. So you can always seek a medical treatment. So if you are a COVID recovered patient and have diabetes, then you should be concerned. But otherwise, there is no much need to panic. Just follow the proper guidelines and you will be safe. Okay, so it's time about the tip which I was talking about earlier in this video. So the tip is very basic, that if you are using these masks, I'm sure you are using it, so then keep your mask changing, because we have a tendency to frequently use these type of surgical masks, and N95 is still okay, but surgical masks should be changed, because whenever you are using these masks and covering your face, see what happens. You are exhaling your air, you get sweaty here, and this is your oral opening. So perfect spot for a fungus to grow. So it's better if you keep changing your mask. If you can't change, then what you can do is at least keep this mask in sun for 3 to 4 hours. It will be fine. And if you're using this type of mask, the risk reduces but always there. So it's better to use new masks. Otherwise fungus is always waiting. अब तो 2 पहनो तो ज़्यादा बेहतर है.